Is there anything that would make somebody not a good candidate to have a labiaplasty?
Somebody who's smoking. If you're putting the
No
cigarette out as you're
nicotine.
walking in the door, like, no, kick rocks. No. So smoking, I know I always feel bad mouthing smoking. I don't know why. Smoking sucks. There's no good reason for it. But nicotine, we know, impairs wound healing. So whether you're chewing it or dipping it or smoking it or e-cigarette or vaping or whatever, just no nicotine, period. Because nothing inhibits wound healing like that. And so the things that I think in plastic surgery that are most prone to, smoking related injuries are labia and, anything with the nipple. So just no. I feel like the thing that catches people, because we're in San Diego and it's super active, is the ability to give yourself time to take a little bit of time off, right?
Yes. It's the most common. We can't do Pilates today? What do you mean?
I mean, it's 2 weeks and I get it. I like to work out every day. I'm with you, but you need to take 3 days off. You need to take 2 weeks off from regular exercise. And those things are kind of non-negotiable. And so we've had people get real big eyes and be like, oh, like, can't do it. I mean, it's such a small amount of time relative to it's a one-time surgery, lifetime of not needing that again. But I get it. When I do a Brazilian blowout, it's 3 days of not getting sweaty and I'm like climbing the walls. In my defense,
But do you actually follow that?
I do, because it won't work otherwise.
Uh-huh.
If I think I can skirt the rules, I will. But yeah, with that one I do, because otherwise it doesn't work. You can't get your hair wet. It's a bummer. So yeah, so I completely sympathize with, but we kind of like it when people come in and are like, oh, I never work out. We're like, yes.
Yes. You could take a couple days. What would
Yeah.
happen if they didn't take a couple days? Like they started moving around like a couple days after surgery.
That's a great question. So again, just like the smoking, I don't offer these cautionary tales because I'm, trying to be mean. It's because the risk is that you'll get a fluid collection or have a bleed. So you can have a post-operative bleed and have a fluid collection of blood, which would be a hematoma. And if that doesn't get recognized, it can lead to increased swelling. It can lead to wound breakdown. And then the whole process of healing will take a lot longer. So it's just a little upfront sacrifice.